Time now for another COVID-19 information segment with our Fox 2 News investigative reporter, Brendan Kirby. Now, Brendan, the Centers for Disease Control and Prevention issuing an alert for a troubling side effect of COVID-19 that appears to primarily affect children. Tell us more about that.
Well, Byron, this is pretty scary. It's similar to a condition called Kawasaki's disease. You may have heard reports of this showing up in New York. A panel of pediatricians at Boston Children's Hospital have given this the not very catchy name of pediatric multi-symptom inflammatory syndrome, potentially associated with COVID-19. CNN has reported that 2 children are hospitalized there and that the Kentucky Health Department is aware of 2 cases there. New York Governor Andrew Cuomo said yesterday that his state is investigating about 100 potential cases. Kawasaki disease is an inflammation of the walls of medium-sized arteries and can damage the heart. Symptoms of the coronavirus-caused complication include persistent fever, inflammation, poor function in one or more organs, and symptoms similar to shock. Dr. Karen Landers, the Assistant State Health Officer in Alabama, told Fox 10 News in a statement that it is monitoring this very closely. She wrote, quote, "At this time, the Alabama Department of Public Health does not have any reports of this illness. However, as with any potentially newly reported syndrome, ADPH will continue surveillance." Now, Byron, we should stress that the vast majority of children who contract COVID-19 appear to do well, but certainly this is something we should keep an eye on.
Yeah, it certainly is. Okay, Brendan, we're constantly on the lookout for anything that can mitigate this health crisis, and one idea that's shown some promise, getting a lot of vitamin D. We got plenty of that here on the Gulf Coast.
Yeah, that sure is true, Byron. It would be great if the solution, or at least part of the solution, were something as common and easy as vitamin D, which comes from sunlight. A recent study published in the journal Aging Clinical and Experimental Research finds a possible link between vitamin D and the ability to fight off infections. It builds on past research that has found that people with acute respiratory tract infections had low levels of vitamin D. The new study examined COVID-19 mortality rates in 20 different European countries, and what researchers found is that there's a relationship between low levels of vitamin D and high death rates. Spain and Italy have particularly high death rates due to COVID-19, and folks in those countries, particularly the elderly, tend to avoid strong sun. Now, combined with other research suggesting that the coronavirus doesn't do all that well in heat and humidity, this is more evidence that maybe we should all be spending more time outdoors.
Sounds good to me. Brendan Kirby, thanks so much.